Good afternoon. Peter Thomas, the General Counsel of National Association for the Advancement of Orthotics and Prosthetics. It's the end of October, and just this week, the Office of Medicare Hearings and Appeals held another forum to discuss the backlog of ALJ cases, mainly surrounding Medicare claims, and some part of which involve orthotic and prosthetic claims for payment. There's a huge backlog. It could be as high as 1 million cases by the end of this calendar year, claims the Chief Judge of the OMHA, Nancy Griswold, and she spoke again at this week's forum. Essentially, the OMHA states that it's been doing a number of things to try to alleviate the backlog in appeals. Unfortunately, most everything that they've stated, they've said before, and in fact, many of the alternatives, many of the reforms that they have in mind, some of which they're implementing, some of which they have in mind to implement in the future, are really not really moving the needle in terms of the amount of appeals that need to go through the ALJ system. So it's a real problem. For instance, the CMS has announced that about 110,000 cases are likely to be settled under the hospital settlement, where CMS will pay 68% on the dollar for short stay claims. These involve acute care hospitals and patients who are admitted for a very short stay in the inpatient setting. That 110,000 settled cases now will eventually come out of the queue, out of the backlog, but that still leaves a lot of cases, which ultimately means that the waiting times for O&P providers to get their cases heard before ALJs probably won't move all that much. Second, CMS has announced a number of different provisions. They've got some demonstration projects that they're working on. They state that under Part B, they are working on some Part B claims to ultimately figure out a way to apply certain holdings and cases to other similarly situated holdings or other similarly situated cases. And that could be a positive development for prosthetics and orthotics cases, but it's too soon to tell. They've also hired 7 new teams of ALJs. Ultimately, they've received an 18% budget in this past fiscal year, and that will enable them to process about 1,000 new claims per ALJ. That's only 7,000 claims a year. And so that's a major issue and something that I don't think that we can get so excited about. Ultimately, this backlog in appeals will continue. CMS continues to state that it is committed to breaking the logjam in the backlog, but it's tough to see how that's going to happen anytime soon. I should say that Congress continues to be interested in legislating on this issue. There have been 2 pieces of legislation introduced in the recent past to address some of these appeals issues, and there could be one more bill introduced in the near future that we're keeping an eye on, and in fact that a number of O&P organizations are working to try to include specific provisions related to orthotics and prosthetics. The election is around the corner. There'll be a lot of news in November that impacts policy, not only impacting healthcare, but orthotics and prosthetics, of course, as well. Thanks very much, and we'll see you next month.